As the country continues to combat supply chain issues amid the coronavirus crisis, one congressman is working to make sure that can't happen again. I'm Jessie Chnor in Washington, and I'll have that story coming up.
A demand to stop all inmate transfers during the coronavirus pandemic. I'm Basil John reporting in Washington why lawmakers believe this will help prevent the spread.
I'm Trevor Shirley in Washington, where a new poll is giving some insight into how the pandemic is impacting Americans' mental health. I've got that story coming up.
The VA secretary orders hospitals open to civilians. I'm Kelly Meyer reporting from Washington what this means in the fight against the coronavirus.
I'm Raquel Martin in Washington. Like soldiers heading into combat, one lawmaker wants to give medical professionals and first responders combating the coronavirus a tax holiday.
House Democrats say they want to review the Trump administration's response to the coronavirus from start to finish.
But hold everybody accountable for decisions that are made in the here and now.
House Speaker Nancy Pelosi called for a new subcommittee on the coronavirus. She says it would make sure in real time every penny of the $2 trillion stimulus package and all future coronavirus funding is spent properly.
And the best way to do that is transparency and accountability.
But Speaker Pelosi says the subcommittee will also review the Trump administration's preparedness in the months leading up to the coronavirus's outbreak.
And anything that affects this many people, we really do have to subject to an after-action review.
Separately, Congressman Adam Schiff is proposing a more focused review commission.
The commission would need to, much like the 9/11 Commission, be able to subpoena witnesses and documents and demand information.
And like the 9/11 Commission, Schiff says its work would be bipartisan.
That looks back in an objective way and says, what did we get right? What did we get wrong? Why were we so ill-prepared?
Our focus right now should be on the health of the American public.
But Minority Leader Kevin McCarthy says both measures are really an attempt to politicize the crisis.
Everything we've done before seemed to be bipartisan. This does not. So I don't know if they're going to a different direction.
McCarthy says Republicans support oversight, but says it should be left to the House Oversight Committee. In Washington, I'm Joe Khalil.
A new Nexstar Media Emerson College poll in one of the nation's coronavirus hotspots says despite job losses and financial worries, New Yorkers fear most for their health.
And generally speaking, there is a rise of concern of actually catching the virus.
And Emerson College Director of Polling Spencer Kimball says another major takeaway from the survey is the impact of social distancing.
We certainly know that what's underlying some of these issues is mental health. And even if people aren't necessarily expressing that publicly, we're seeing this in the data.
24% of respondents said mental health has been the biggest impact of social isolation.
People are feeling lonely, they're feeling isolated, higher anxiety levels and depression levels.
But Kimball says the type of mental impact depends a lot on someone's age.
Older people are reporting a higher level of isolation, but younger people are the ones reporting higher levels of anxiety and depression.
If there is an upside, Kimball says, it's that data shows lifestyle changes feel less jarring than several weeks ago.
And what that means is that people are kind of settling into this new normal that they're living.
Yet despite that, the data shows a majority, 54% of those polled don't think their lives will ever return to exactly how they were before the pandemic. Reporting in Washington, I'm Trevor Shirley.
Arkansas Congressman French Hill says Americans have been caught off guard by problems with medical and pharmaceutical supply chains amid the coronavirus crisis.
We need to not ever have that happen again.
Hill has introduced legislation that he says would make the U.S. more prepared for the next public health emergency.
We've just realized the last 2 months that a lot of our supply chain is offshore. It has limited number of participants, and sometimes they're all in China.
It would treat medical supplies like ventilators, protective gear, even vaccines, the same way it treats defense supplies needed to build planes, ships, and missiles. The legislation would amend the Defense Production Act, a powerful emergency law that allows a military leader to take over factories and supply chains and distribute the products where needed.
My bill would make sure the president has a strategic plan in place to do that going forward, where we have a little less mystery about this.
Even Hill's Democratic colleagues in the House, like Alabama Congresswoman Terry Sewell, agree that Congress should act to give the DPA more teeth.
Ensuring that not only we can manufacture the equipment we need, but we also can preserve the prescriptions and the drugs that we need stateside.
Hill says he hopes to build support for his plan when Congress returns to the Capitol in the weeks ahead. In Washington, I'm Jessie Tenor.
While most of America stays home, millions of healthcare workers are gearing up for what's expected to be the worst week yet of the coronavirus outbreak.
They are going to work so we can stay home.
Michigan Congressman Bill Huizenga says it's heroic work and deserves recognition.
When the president and others started using sort of this language about, we're at war with this virus, it really registered and it clicked.
Like soldiers serving in combat zones, Huizenga wants to give medical workers and first responders combating the virus a federal tax holiday for the next 4 months.
It's a small way, I think, of us saying thank you.
Huizenga's HEROES Act would give tax relief to anyone from correctional officers to nursing home workers as long as they worked in a county with coronavirus cases.
I think there's going to be a lot of bipartisan support for this.
But Adam Michelle from the Heritage Foundation is hoping not. He calls the plan a bad one-size-fits-all strategy.
A blanket federal tax holiday, I don't think would be well targeted to the people that we're trying to help, nor would it provide any additional incentive to move people, move nurses or doctors to hotspot areas.
Michigan Democrat Dan Kildee is reviewing the bill and said in a statement that we must find additional ways to support our frontline workers during this crisis. Huizenga says he hopes to pass the HEROES Act on its own without being attached to the Democrat-led fourth stimulus bill he says could be bogged down in partisan debate. In Washington, Raquel Martin.
We want them to pause the moving of the inmates.
Pennsylvania Republican Congressman Fred Keller says the Federal Bureau of Prisons should stop inmate transfers during the coronavirus pandemic. Keller has introduced the Pandemic Act, which would pause the transfers to protect inmates as well as the men and women who work at the facilities.
Let's make sure that our corrections officers are safe by not transmitting people that may be infected, but then also protecting the community where the corrections officers live.
Democratic Congressman Matt Cartwright is co-sponsoring the bill.
There's no way you can avoid getting up close and personal with inmates at these corrections facilities. And these are corrections officers that go home to their families at night and expose them to the danger.
As of April 5th, the Bureau of Prisons says 138 inmates and 59 staff members have tested positive throughout the country. The Bureau says it's reduced the number of transfers, but Keller and Cartwright says the BOP needs to stop for now.
It doesn't matter where somebody's serving a sentence during this pandemic, stay put. I mean, everybody else has put their lives on pause.
It's a recipe for disaster if we allow these transfers to happen.
Keller and Cartwright say if the movement doesn't stop, COVID-positive inmates, officers, and other staff will need treatment from already overwhelmed healthcare providers, a situation both representatives want to avoid. Reporting in Washington, I'm Basil John.
The Department of Veterans Affairs is joining the fight against the coronavirus pandemic.
Not only to protect veterans, but also to help the American people.
Veterans Affairs Secretary Robert Wilkie is opening VA hospitals to civilians to take some of the burden off hospitals on the front lines.
We are lacking in enough beds to meet the needs for COVID patients.
Democratic New York Senator Kirsten Gillibrand represents one of the states hit hardest by the virus. The order opens about 100 beds in the New York City area.
Could be overflow for New York hospitals and hospitals in other states that are in the peak of their crisis.
Beyond New York, Secretary Wilkie's order also opens up hospitals in New Jersey, Michigan, Massachusetts, and Louisiana.
If the VA secretary feels comfortable in allowing and opening it up, obviously they feel like they have the capability and the capacity to take on patients, and I think that's great for our country.
Member of the House Veterans Affairs Committee and Republican Florida Congressman Greg Steube says he's been getting daily updates from the VA since the crisis started. He believes the hospital is in the position to take on this new challenge.
I think it's a great show of respect from the VA and from our government to try to help people in need.
About 1,500 beds are expected to be available at first. Reporting in Washington, I'm Kelly Meyer.
Good morning. Sorry I'm a few minutes late. It's just been a crazy evening. It's not easy out here. You know, I'm going to be in this car now for the next anywhere between 8 and 12 hours today. Like I was yesterday, like I've been for the past 2 weeks. It's a calling. It's definitely a calling. It takes a special person to do this. And my father was a homicide detective, so he was able to take me to see what an autopsy looked like. The medical examiner turned around to him and he said to my father, he said, "Sir." I said, "Sir." Well, he didn't get sick.
All right. Ready? Funeral homes are overwhelmed, and there is no number. People are dying, and we're running out of space in all the funeral homes. Wherever we go, there's people, you know, with dignity. Right now, the crematory's a week behind.
Yeah. Like traditionally, where I would be able to help you, I have to tell you, it might be 2 weeks before we can bury your loved one or have any type of services. That's the sad thing.
Do we know how large the person is? Just get them lined up before you let go. 80th Street. Watch your back.
I'm treating everybody today that they have the virus. I have to.
Okay. Next stop, boys.
The hospitals are overwhelmed, like everyone else right now. Yesterday I went to 2 different facilities in Brooklyn, and they have refrigerated trucks, 40, 50-foot refrigerated trucks outside of their facilities with human remains in them.
Oh no, this is way beyond normal. This reminds me of the AIDS epidemic back in the 80s, late 80s and early 90s. People didn't know what it was. It was very scary for a lot of people, us especially being the funeral director. And it doesn't matter how old you are or what your health is. If you're 25 and super healthy or 95 and super sick, it's sad.
point-of-care testing for COVID-19 is a very important part of the containment strategy as we deal with this pandemic. So in partnership with the federal, the state, and the local government, we're proud to bring a point-of-care testing site to Atlanta, Georgia, where we have capacity to test up to 1,000 patients and provide real-time results within 30 minutes. Yeah, our max capacity is 1,000 per day. That's what we have done the setup based on. And as of right now, we have about 490 appointments for just today itself. So I'm pretty confident that we're going to hit that 1,000 test target today.
Plateau, not plateau, we still have to extend New York pause, because if that curve is turning, it's turning because the rate of infection is going down. One of the reasons the rate of infection is going down is because social distancing is working. We have to continue the social distancing. Schools and non-essential businesses will stay closed until April 29th. The local governments are charged with enforcement. I want them to enforce them. And I want to be, frankly, more aggressive on the enforcement, because all the anecdotal evidence is people are violating it at a higher rate than before. So we're going to increase the potential maximum fine from $500 to $1,000. But it's not really about the fine. Nobody wants the money. We want the compliance. We are serious. And we have been behind on this virus from day one. And this virus has kicked our rear end. And we underestimate this virus at our own peril. We learned that lesson. Now is not the time to slack off on what we're doing.
You heat the masks to about 158 degrees for 30 minutes, and then they're sterilized. And these masks then come out the other side, individually wrapped, and you can then take them back to the hospital and they can be reused. And the early data on it says you can do it 20 times, perhaps more, but we're going to start with that. But each time we're going to test it to make sure that in no way have we compromised the integrity of these masks. Some are already at this point where, you know, they're reusing the masks in ways that, you know, aren't ultimately going to be safe. So the key is there's not enough, and this is a way to reliably make sure that the supply is maintained.
Nadya, who's a 4-year-old female Malayan tiger, developed a cough. And over the course of a week, 4 tigers and 3 lions developed coughs. Some had wheezing, some were off food a little bit, and they were not, you know, seriously ill, but Nadya just didn't seem to be progressing the way we would like. So we anesthetized her for diagnostic testing. There were no sick people that worked with the lions or the tigers, but there was some person who either didn't know they were infected or hadn't become sick at the time they worked with the tigers. So we know it's human to lion and tiger, but we don't know the specifics. The original spread from an animal to person, probably from a bat to a person in one way or the other, occurred, and that's how people became infected. In the subsequent months, as this pandemic has spread around the globe, people-to-people transmission is the infection route. There's no evidence that, other than that initial spillover, that any animal has infected any person anywhere. And this actually is the first really well-documented example of a person infecting an animal and an animal getting sick. So the fact that we ran an animal COVID test has nothing to do with the human COVID testing, and there's no competition between the two. There wasn't a choice made, that we were gonna spend a human test on an animal. They're two parallel testing pathways.
Oh, say, can't you see by the dawn's early light what so proudly we held at the twilight's last gleaming, whose broad stripes and bright stars through the o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the that our flag was still there. Oh, say, does that star spangled